So one thing I want to speak about before we talk about your upcoming program is splint therapy. My gosh, people are so confused about splints. It's one of the most controversial topics. It gets a lot of questions when anytime anyone posts on social media about splints. And there are, like all parts of dentistry and occlusion as well, there are very polarizing views. And we can go into the whole anterior midpoint stop appliances and those who are really against it and whatnot. But one thing I want to just talk to you about is that, or tell you, is that your DASA, so dual arch anterior midpoint stop line protocols that you showed was amazing, and the way the cases that you showed and the application of confirming centric relation prior to rehabilitation, and you talked about the different indications. That was great, and I've been using that in a lot of my patients, and it's been a real game changer for me. So
I'm glad you've had success with that.
I'm using that all the time in practice, in the right indications, and seeing great success with it. So can you tell us, just briefly to anyone who's not familiar with these sort of appliances, is why you think they have a place in practice? Is that too broad?
No, but I would actually probably even want to make it broader. Is why would you use any appliance to begin with? And that's where I always want to start. I always want to start with the why. We get into arguments, as you say, and we get into disagreements because people have their what and their how, and they want everybody to do their same how. Like, you have to do my how. You have to use my how. My appliance is the right one. My, this. But in so many of those discussions, we're missing the why. So why do we use orthotics? Why do we use occlusal splints? Why do we use bite guards, night guards, whatever you want to call them? There are just a few very simple reasons why we use them. We use them to get people out of pain. We use them to help protect things, and we use them to help figure things out. Palliative, protective, diagnostic. So if someone is hurting, and they could be hurting in their teeth, they could be hurting in their muscle, or they can be hurting in their joint, they need a palliative splint. I don't care what design it is. If someone is breaking their teeth or breaking their restorations and they want to keep those restorations intact, then they need a protective splint. Now, if we need to figure something out, whether it's in other camps that want to figure out chewing patterns, or my approach if we want to figure out parafunctional patterns, or if it is important a joint position, then it is a diagnostic approach. And you can use full arch appliances for all of those applications, and you can use anterior midpoint stops for all of those applications. It goes back to the exact same thing that we were talking about at the beginning of this chat, is we have a lot of tools, but we have to have goals, and then we have to balance efficiency with them. The reason that I personally like anterior midpoint stop appliances, or as you said, the DASA splint that I shared with you, the dual arch anterior scribe or stop appliance, is that when we only hit plastic to plastic in the front, there are no teeth touching. So if you want to protect teeth and you have no teeth touching, the teeth get protected. Now, if we have pain, or if we have muscle pain, and we want to knock that muscle pain down, when we only hit at the midline, the temporalis and masseter are knocked down by 70% to 30% muscle activity. Less muscle activity can mean less muscle pain. Now, in the third application, if you're looking to get the joint to seat and the joint is not seated, and you only have a midpoint stop appliance, then once those muscles have their activity knocked down, and there's no plastic in the back and in the way for the condyle to seat, then the condyle can seat. So when I look at an anterior midpoint stop appliance or the DASA appliance, I look at it as efficient. Now, of course, after that, everybody's going to scream anterior open bite, anterior open bite. Well, you know what? If your condyle seats, you have the potential to get an anterior open bite. So if our profession was using CR appliances all these years, where are all the anterior open bites? So there are ways to prevent anterior open bites. If you want the condyle to seat and you have a severe wear case, that can be a good thing. But say you just want to protect the teeth, or say you just want to have palliative care of the muscles, there are adjunctive appliances that we can use to help maintain MIP, or maximum intercuspation position. And that appliance is in the States, at least, is called an AM aligner. And it doesn't come from CR dentistry. It actually comes from sleep apnea or sleep medicine. So in sleep medicine, when we were repositioning mandibles forward so we can keep an airway open so people don't die, what we were able to figure out, or what they were able to figure out, is before we started the anterior repositioning splint, what we did was we took a wafer bite in MIP, and then they wear their nighttime appliance. Then when they take their nighttime appliance out, they put that wafer in, they could relearn, or they could maintain MIP so that they didn't develop posterior open bites. We can use that same approach to help avoid anterior open bites when we're only doing a protective or palliative approach and don't want any occlusal changes. I know I just went on blathering for a few minutes, but you obviously hit on one of my passionate points.
Mike, in the last 3 minutes, I don't know how long you spoke for. You've literally done such a fantastic summary of splints. So that's amazing. Thank you. And for anyone in the UK listening, I have found the supplier for AM aligners in the
Oh, great!
Discuss that and share that as well. So yes, that's a very a unique part of your program that I learned about these AM aligners and the DARSs, which have been a great staple appliance. So thank you so much for that. So I think that's all we've got the time for today. Otherwise, we could be speaking forever about this.
This has been, I have to tell you, Jazz, this has been a really, really lovely chat. I've had fun with just chatting with you, talking with you, discussing, bringing up thoughts. But I love the format as well.
Thank you so much. And obviously, we want to talk about your upcoming event now. So Occlusion in 2020, 29th and 30th of May. Okay, you'll be coming to Heathrow, London, to the Sheraton Skyline Hotel. What is your program about?
Program in Heathrow, Occlusion in 2020, Occlusion in Everyday Practice, the 29th and 30th. What I'm going to do, and what I'm going to aim to do, is take the attendees on a journey from one-tooth dentistry all the way up to full mouth rehabilitation. I want to blend theory and practicality. And if you've heard one consistent theme in our discussion, it's understanding the why and not regurgitating the how or the what. I want people to understand not just how to do something, but why they're doing it. Because when you understand the why, you can flex from one-tooth dentistry to two-tooth dentistry, to arches, to quadrants, to full mouth. So if you're a practitioner right now doing single tooth dentistry and kind of nervous about jumping up to two-tooth or three-tooth or quadrant dentistry, we're going to have something for you. If you're already doing that quadrant dentistry and you aspire to do, arch or even full mouth, we're going to have something for you too. And based on my past experience of doing this program for a couple of decades all over the world, having new practitioners and advanced practitioners and specialists, we're going to have something for you to take home as well, because it is to be a better dentist the day after this program in some way, shape, or form. I know we're going to have a great time. We're going to be going over lots of cases that blend in the theory with reality and how it happens in everyday private practice.
And there's a restaurant at that hotel. It's called Madhu's.
Oh, this is the important part.
I knew you'd like this. Okay, so it's called Madhu's, and it has the best, most tender, most succulent lamb chops you've ever had.
Well, now I'm there. I'm signing up.
Great, Miguel. Thank you so much, and it's really always a pleasure talking about occlusion with you. And we look forward to seeing you in London in May 2020.
We'll see you there. Thanks for inviting me.